Scabies, the best treatment options. Scabies is a niche, highly contagious skin disease caused by an infestation by the itch mite Sarcops scabii. Direct skin-to-skin contact is the mode of transmission. A severe and relentless itch is the predominant symptom of scabies. Sexual contact is the most common form of transmission among sexually active young people, and scabies has been considered by many to be a sexually transmitted disease, although not all cases are transmitted sexually. Signs and symptoms of scabies include a skin rash composed of small red bumps and blisters that affects specific areas of the body. Other symptoms can include tiny red burrows on the skin and relentless itching. The itchy skin leads to frequent scratching, which may predispose the skin to secondary infections. Treatment includes oral or topical scabicidal drugs. Over-the-counter remedies or home remedies are not effective in eliminating scabies. Causes a scabies infestation. Scabies is a niche, highly contagious skin disease caused by an infestation by the itch mite Sarcops scabii. Mites are small 8-legged parasites. They are tiny, just 1/3 millimeter long, and burrow into the skin to produce intense itching, which tends to be worse at night. The mites that infest humans are female and are 0.3 mm to 0.4 mm long, the males are about half this size. Scabies mites can be seen with a magnifying glass or microscope. The scabies mites crawl but are unable to fly or jump. They are immobile at temperatures below 20 C, although they may survive for prolonged periods. At these temperatures, scabies is very contagious, and direct skin-to-skin contact is the mode of transmission. Scabies mites are very sensitive to their environment. They can only live off of a host body for 24-36 hours under most conditions. Transmission of the mites involves close person-to-person contact of the skin-to-skin variety, so risk factors include close contact with an infested person. It is hard, if not impossible, to catch scabies by shaking hands, hanging your coat next to someone who has it, or even sharing bedclothes that had mites in them the night before. Sexual physical contact, however, can transmit the disease. In fact, sexual contact is the most common form of transmission among sexually active young people, and scabies has been considered by many to be a sexually transmitted disease. However, other forms of physical contact, such as mothers hugging their children, are sufficient to spread the mites. Over time, close friends and relatives can contract it this way, too. School settings typically do not provide the level of prolonged personal contact necessary for transmission of the mites. Catch scabies from a dog or cat. Dogs and cats are infested by different types of mites than those that infect humans. Animals are not a source of spread of human scabies. Scabies on dogs is called mange and is sometimes referred to as sarcoptic mange. When canine or feline mites land on human skin, they fail to thrive and produce only a mild itch that goes away on its own. This is unlike human scabies, which gets worse and worse unless the condition is treated. Risk factors for scabies. Scabies can infest any human who comes in contact with the mites. The only known risk factor is direct skin contact with someone who is infested. The contact one experiences in social or school settings is not likely to be sufficient to transmit the mites. Sexual or other close contact is required to spread the condition. The condition does appear in clusters, so outbreaks may occur within a given community. Scabies symptoms and signs. Scabies produces a skin rash composed of small red bumps and blisters and affects specific areas of the body. Scabies may involve the webs between the fingers, the wrists and the backs of the elbows, the knees, around the waist and umbilicus, the axillary folds, the areas around the nipples, the sides and backs of the feet, the genital area, and the buttocks. The bumps may contain blood crusts. It is helpful to know that not every bump is a bug. in most cases of scabies affecting otherwise healthy adults. There are no more than 10-15 live mites even if there are hundreds of bumps and pimples on the skin. The scabies rash is often apparent on the head, face, neck, palms, and soles of the feet in infants and very young children, but usually not in adults and older children. Textbook descriptions of scabies always mention burrows or tunnels. These are tiny thread-like projections, ranging from 2 mm to 15 mm long, which appear as thin gray, brown, or red lines in affected areas. The burrows can be very difficult to see. Often mistaken for burrows are linear scratch marks or welts that are large and dramatic and appear in people with any itchy skin condition. Scratching actually destroys burrows. Scabies feel like. It is important to note that symptoms may not appear for up to 2 months after being infested with the scabies mite. Even though symptoms do not occur, the infested person is still able to spread scabies during this time. When symptoms develop, itching is the most common symptom of scabies. The itch of scabies is insidious and relentless and often worsens over a period of weeks. The itch is typically worse at night. For the first weeks, the itch is subtle. It then gradually becomes more intense until, after a month or two, sleep becomes almost impossible due to the intensely itchy skin. What makes the itch of scabies distinctive is its relentless quality, at least after several weeks. Other itchy skin conditions, eczema, hives, and so forth, tend to produce symptoms that wax and wane. These types of itch may keep people from falling asleep at night for a little while, but they rarely prevent sleep or awaken the sufferer in the middle of the night. Scabies infestation diagnosed. Scabies is suggested by the presence of the typical rash and symptoms of unrelenting and worsening itch, particularly at night. Ultimately, the definitive diagnosis is made when evidence of mites is found from a skin scraping test. By scraping the skin sideways with a scalpel blade over an area of a burrow and examining the scrapings microscopically, it is possible to identify mites, eggs, or pellets. This process can be difficult, however, since burrows can be hard to identify. Sometimes scratch marks are mistaken for burrows, and even the examination of scrapings from 15 or more burrows may only reveal 1 or 2 mites or eggs. If the characteristic physical findings are present, scabies can often be treated without performing the skin scrapings necessary to identify the mites. Polymerase chain reaction testing is available to identify the genetic material of the scabies mites when the diagnosis is difficult, though this is not generally used. The mites can also be identified in skin biopsies that are performed when other causes of skin disease are suspected. Treatment options and home remedies for a scabies infestation. Curing scabies is rather easy with the administration of prescription scabicide drugs. There are no approved over-the-counter preparations that have been proved to be effective in eliminating scabies, and home remedies are not effective. The following steps should be included in the treatment of scabies. Apply a mite killer like permethrin. These creams are applied from the neck down, left on overnight, then washed off. This application is usually repeated in 7 days. Permethrin is approved for use in people 2 months of age and older and is considered to be the safest and most effective treatment for scabies. An alternative treatment is 1 ounce of a 1% lotion or 30 grams of cream of lindane, applied from the neck down and washed off after approximately 8 hours. Since lindane can cause seizures when it is absorbed through the skin, it should not be used if skin is significantly irritated or wet, such as with extensive skin disease, rash, or after a bath. As an additional precaution, lindane should not be used in pregnant or nursing women, the elderly, people with skin sores at the site of the application, children younger than 2 years of age, or people who weigh less than 110 pounds. Lindane is not a first-line treatment and is only recommended if patients cannot tolerate other therapies or if other therapies have not been effective. Resistance to this medication has also been frequently reported. Doctor treats scabies. Scabies is treated by a number of different healthcare professionals. The condition is commonly treated by primary care providers, including pediatricians, internal medicine specialists, and family medicine specialists. Many patients with skin symptoms seek treatment from a dermatologist or pediatric dermatologist. Sometimes, the condition may be first treated by an emergency medicine specialist if the patient seeks care in an emergency department. Scabies often misdiagnosed. Scabies is very easy to misdiagnose because early subtle infestation may look like small pimples or mosquito bites. Those affected may believe they have another condition, such as bedbug bites or other kinds of rashes. Over a few weeks, however, mistakes like this become evident as patients feel worse and worse with symptoms they can't ignore. Complications of scabies. The intense itching of scabies leads to prolonged and often intense scratching of the skin. When the skin is broken or injured due to scratching, secondary bacterial infections of the skin can develop from bacteria normally present on the skin, such as Staphylococcus aureus or beta hemolytic streptococci.